Hello, I'm Richard Parkinson. This is a video of a Botox procedure. So, this is the start of the procedure, and the telescope's just been placed inside the bladder. And what we do at the start is just have a look around, see if the bladder looks normal and healthy. In this case, it does, looks entirely fine. That's the telescope looking back at the opening of the bladder. And while we're doing this, we're filling up the bladder to about halfway full, so the patient's got a comfortably full bladder, and that helps the injections to proceed easily. And the assistant is now just going to place a long, thin, flexible needle down the telescope, and that's going to come out through into our vision in a second. So there we go. So that needle's quite magnified, it's really quite tiny. The assistant just injects a few bubbles out, so we're ready to go, and we're going to just place the first injection just under the surface of the bladder. We're injecting about 1 ml of fluid. In most patients, we administer 20 injections, each 1 ml in volume. And in total, there's 100 units of Botox, although sometimes we use a higher dose where patients need a higher dose. The higher doses can sometimes be a little bit more effective, may last a little bit longer. However, a higher dose of the Botox does lead to a higher risk of problems with bladder emptying. And we know that one of the difficulties that some people have is that they won't be able to empty their bladder as efficiently as they did before. So we're proceeding with injections along the middle of the bladder. Now we're going to go over to one side of the bladder and start injecting on that side as well. The procedure takes 5 or 10 minutes to do usually. Most patients find it reasonably comfortable, though the injections can be a bit sore for some people. I do about 90–95% of these under a local anaesthetic, and most people prefer that. But for some people, we do it under a general anaesthetic, and if people find it uncomfortable, that can be preferable for them. So after the procedure, we always warn people it's a little bit uncomfortable, and there's some discomfort and irritation while they pass water for a day or two, and that usually settles on its own. A little bit of blood is not uncommon, and that's nothing to worry about. Occasionally people do get a urinary infection, and if they get persistent irritation or they're feeling unwell, then we may need to give some antibiotics. The injections can work very quickly, and within a few days the symptoms are improving, but occasionally the symptoms will persist for a couple of weeks before the injections work. If patients are on tablets, I generally recommend they continue those tablets until their Botox injections have started to kick in, and then if they're on medication for the bladder, that can be stopped. So Botox injections can be extremely effective, and the majority of patients consider their symptoms to either completely resolved or be considerably better. So we keep a regular audit of all the patients having Botox injections, and we monitor things quite closely. And 85% of patients who have Botox injections consider themselves to be very much better after treatment. We know that Botox injections will wear off over time, and the effects tend to last for between about 6 and 12 months, and the symptoms will then start to come back gradually, where you say to people they can restart their bladder medication at that stage if that's helpful, and they just give us a call and let us know. We bring them back into the clinic to do the treatment again. We can do the Botox injections as many times as we want within reason. We've got many patients who've been coming for over 10 years for treatments. So a couple of problems people have. So we know that one of the most important side effects of Botox treatment is bladder emptying problems. So most patients can pass water okay, but if there's a problem, then the bladder maybe doesn't empty fully, and The patient may be aware of this, or they may not be fully aware that there's a significant volume of urine left behind after they've passed water. So sometimes people just notice that they're getting recurrent water infections, or they're perhaps having to go to the loo more often because the bladder's persistently full. So if there are any bothersome symptoms after Botox injections, or if the injections appear not to have worked very well, it's essential that we check the bladder is emptying properly by doing a bladder scan, or passing a little catheter into the bladder. About 1 in 10 people will have difficulties emptying the bladder, in my experience, and what we will then do is show them how to pass a small disposable catheter into the bladder after each visit to the toilet for a wee, and that catheter will enable them to drain any residual urine out. They'll need to continue to use that catheter for as long as there's a problem with bladder emptying, and typically this lasts for about 10 to 12 weeks, and then things will go back to normal. But it's very unusual to have persistent problems with bladder emptying after Botox injections. So we're just finishing off the last couple of injections here. We put Botox, as you can see, around the whole of the back wall of the bladder, a couple near the entrance of the bladder.